the kinds of things that we need now in Ukraine, although having ambulances is great, the Canadian surgical program is actually the better of the two, because the surgical team came to Ukraine, operated in a hospital together with their Ukrainian colleagues, and passed along the knowledge and experience that they had, and left behind a legacy of an entire team of doctors who can now do what the Canadian doctors taught them, what the Canadian doctors can do. They also set up a telemedicine communication between the two hospitals. So now the Canadian doctors can even help the Ukrainian doctors and give them advice on patients, and that makes the most impact on healthcare. It is nice to have ambulances, but in Ukraine, we don't have paramedics. We need to teach paramedics how to work better. The ambulances will come. We have programs of training, which are much more important, and education that are much more important than actual things. I know that it's sometimes easier to send over an ambulance rather than to spend 4 weeks training a doctor who works on the ambulance service to be a paramedic, because it's easier to perhaps see an immediate result because you sent an actual object, whereas it will take us a year or two to see the results of training paramedics in Ukraine, so that we save more lives and we have a higher survival rate in the pre-hospital phase of care, rather than when patients die before they ever even reach the hospital. So there's a big need, a very large need in financing and helping with personnel to do training programs for first responder courses. In Ukraine, the police and the firemen and, say, bus drivers, they're not taught first aid courses. They don't know what to do if there's a car accident. The police puts up cones and directs traffic, but the people who are in the car don't get any care because they're not taught how to give any care. The next level, the ambulance shows up and they have very little training in what to do. When there's an emergency situation, there isn't a very high level of training available for emergency care. Then it gets to the hospital level, and in the hospitals, we don't have trauma rooms, trauma teams. We don't have emergency rooms in Ukraine. And again, it's not a reconstruction that has to happen, and not a lot of equipment that needs to be bought, because most of those hospitals have that equipment. It's just dispersed throughout the hospital in different departments, instead of reorganizing the hospital so that there's a single place where all the doctors can come to see the patients when they come in and they're sick, and that there's an ultrasound machine right there and an EKG machine right there and a ventilator right there, and the ICU is right around the corner if you have to take the patient into the ICU, and immediately there's an emergency room doctor, 2 emergency room nurses, a surgeon that comes to see them, and a respiratory therapist. That's the way that it works in emergency rooms and emergencies that happen in the West. In Ukraine, my organization that I founded, that is now, or the organization that I founded, that Patriot Defense, which is now doing a lot of work and continuing to work, actually have courses in first responder, which the Ministry of Health is now approving as the official course for all fire and police, and also trauma courses, Ukrainian trauma life support, which is being put into the educational process for post-diploma or postgraduate training for physicians. These types of courses are what really need to be funded and need to be financed, need to be expanded over the entire Ukraine. It's been going pretty well with working with the police, the national police here in Kyiv and in many of the cities. And the police have been very open to having the additional training with them. But we need to expand that. Not just in Kyiv, not just in Poltava and in the big cities, but so that there's training for all of the police in Ukraine. Also the fire department, so that they get the training that they need. Introducing a system where there are EMTs, emergency medical technicians, and paramedics There are now educational programs that we're completing, and starting in September of 2017, we're hoping to start the programs in medical colleges for paramedics and doctors having to be trained in trauma. There are very many Ukrainian, doctors of Ukrainian descent, paramedics and others who could really help a lot in the training that we need here in Ukraine. But we need knowledge, we need experience, and then we need financing to bring them over and be able to do these programs.